Thank you, Mr. Speaker. Good afternoon, Mr. Speaker.
Good afternoon, sir.
Thank you, Mr. Speaker. This is a good bill. It's a bipartisan bill. It ought to pass. Having said that, I would like to discuss this bill with my good chair, and I'm sure members of both sides of the aisle will have some questions for clarification purposes, knowing very well and echoing the sentiment that was so well expressed by our good chair. Unfortunately, we continue to be in an opioid crisis, what I call as an opioid curse. The only one good thing about this opioid is it does not discriminate. And we have seen that. We have seen this curse. We have seen the crisis in towns, in our cities, in rural towns, in urban towns. It does not matter whether one is affluent or non-affluent. And unfortunately, as the good chair said, most of us, our lives have been touched directly or indirectly by the impact of this opioid crisis. And systematically, in every session, we have tried to do this in a logical way, stepwise fashion, to make sure that we do it, yes, in steps, but we do it the right way. So through you, Mr. Speaker, for clarification purposes, to the good Chairman of Public Health.
Representative Steinberg, please prepare yourself. Please proceed. Representative Srinivasan.
Through you, Mr. Speaker, we see that the agencies, the commissioner is now allowed to share information with the other agencies. Through you, Mr. Speaker, what kind of information would be shared and what kind of controls do we have that this information is shared appropriately? Through you, Mr. Speaker.
Representative Steinberg.
Thank you, Mr. Speaker. That's indeed an excellent question. I'm wondering if the good representative who asked the question would be willing for me to yield to my colleague, Representative D'Agostino, who has had direct experience in the General Law Committee with this particular section. Through you, Mr. Speaker.
Representative O'Neill. You can't yield.
Thank you, Mr. Speaker. Representative Srinivasan has the floor, and he cannot, as the person who asked the question, cannot yield to any other member. So if perhaps Representative Srinivasan were asked to be direct his question to a different member, the appropriate process.
Thank you, Representative O'Neill. Your point is well taken. We were going to proceed in that fashion. Representative Srinivasan, could you redirect your question, please, to the person that, if you'd like.
Through you, Mr. Speaker, I definitely will do that. Through you,
Please proceed to Representative D'Agostino.
Thank you, Mr. Speaker. Through you, Mr. Speaker, to Representative D'Agostino, with your kind permission. My question is that when this information is shared by the Commissioner to the various agencies, I get that. It is important to share that information, but what kind of guidelines do we have? What kind of oversight do we have in this sharing of information? Through you, Mr. Speaker.
Representative D'Agostino. D'Agostino.
Thank you, Mr. Speaker.
Please proceed.
Through you, Mr. Speaker. So the section that the doctor is referring to relates to the prescription monitoring program that the state established in 2013. The state has a prescription monitoring program for Schedule II to Schedule V substances that is maintained by the Commissioner of the Department of Consumer Protection. And all prescribers and pharmacists have to report prescribing information for those types of controlled substances and have been doing so for the past 4 years. There's very strict requirements on the confidentiality of that data because it is patient-specific. The reason the PMP program exists is so that prescribers in particular can be aware if a patient is receiving a prescription for a scheduled controlled substance from another provider. So that's maintained in confidentiality in accordance with all state and federal confidentiality requirements and under federal law, in particular under HIPAA. What this section does is it allows the DCP commissioner to share specific information in the PMP program with the head of another state agency to study very specific things, disease prevention, control related to opioid abuse, study of morbidity and mortality caused by overdose of controlled substances. Anytime the commissioner shares that data pursuant to this section, it has to be pursuant to a written agreement with the agency head. That agreement has to set forth what's in the statute, that it is shared for those specific purposes. And specifically, the data must be maintained confidential in accordance with all the other statutory schemes that we have and, of course, federal law. So, for example, if HIPAA would prevent the sharing of patient-specific information for a general study, you would not be able to share patient-specific information. And I would imagine that given the limited purpose for the sharing here, the overall studying of overdose, that what we're talking about sharing for the most part is overall numbers with respect to prescriptions rather than patient-specific data. Through you, Mr. Speaker.
Representative Srinivasan.
Through you, Mr. Speaker, in this sharing of information, will it be commissioner to the head of an agency, or could it be anyone that the head of the agency, the commissioner, designates? Through you, Mr. Speaker.
Representative D'Agostino.
Through you, Mr. Speaker, the provision is very specific. It is commissioner only to the head of the agency. There's no provision here for designation to other members of staff. A specific agreement between the two agency heads.
Representative Srinivasan.
Through you, Mr. Speaker, since the information is shared between the commissioner and the agency head, but for work to be done, obviously others will have to be looking at that data from that data to figure out what is the mortality, what is the morbidity. So others will definitely be involved in looking at the data and examining the details of the data. Will that be allowed through this piece of legislation? Through you, Mr. Speaker.
Representative D'Agostino.
Through you, Mr. Speaker, the point's well taken. Certainly the appropriate staff members, once the data is transmitted, are allowed to review and study the information. The point I was trying to make is that there's no way that someone other than a commissioner could agree to transmit the data. That has to be at the highest level. Once it is transmitted, of course, the appropriate agency head staff would be able to use that data to accomplish the purposes of the section in terms of study. Through you.
Representative Srinivasan.
And through you, Mr. Speaker, all of the necessary privacy and confidentiality will be maintained regardless of whether it is the state agency head or the staff. Through you, Mr. Speaker.
Representative D'Agostino.
Through you, Mr. Speaker, absolutely.
Representative Srinivasan.
Thank you, Mr. Speaker. And if you can continue with the rest of the amendment so that we can discuss the various other aspects of the amendment. Through you, Mr. Speaker.
Please proceed.
Through you, Mr. Speaker, in lines 81...
Representative Srinivasan, just for a point of order, who do you wish to direct this question to?
To the Chair of Public Health, Representative Steinberg.
Please proceed, sir.
Thank you, Mr. Speaker. Through you, Mr. Speaker, lines 81 to 94 describe in detail how the drugs, the opioids and the opioid-related drugs can be disposed of. Through you, Mr. Speaker, it talks about a registered nurse. Through you, Mr. Speaker, is this registered nurse, does it have to be an RN, or could it be an LPN, or who is allowed to make sure that these medications are disposed of appropriately? Through you, Mr. Speaker.
Representative Steinberg.
Thank you, Mr. Speaker. My understanding is this is as designated by the Department of Public Health. It may refer to a registered nurse. I could not go further than that. Through you.
Representative Srinivasan.
Through you, Mr. Speaker, I see in lines 91 to 94 that nothing in this legislation prevents these medications being dropped off in a drug box. Through you, Mr. Speaker, in a drug drop box. Can that still be done? Through you, Mr. Speaker.
Representative Steinberg.
Thank you, Mr. Speaker. Through you, that is correct. Through you.
Representative Srinivasan.
Through you, Mr. Speaker, for the medications to be dropped off in the drug box, would there be a need for permission from family members or any other person that is involved with this patient. Through you, Mr. Speaker.
Representative Steinberg.
Through you, Mr. Speaker, my understanding is that there's always consultation with the families before it's disposed of. One of the important aspects to make sure that a trained medical professional is involved with this conversation is that the person involved can explain to the family the importance of disposing of unused medication. Through you.
Representative Srinivasan.
Through you, Mr. Speaker, maybe the good chair can explain to us lines 106 through 108, where a controlled substance is being prescribed to an inanimate object. Through you, Mr. Speaker.
Representative Steinberg.
Thank you, Mr. Speaker. That is an interesting reference, isn't it? Obviously, I think the objective is to make sure that there is always an individual, a specific person to whom such an important drug is prescribed, and there can be no subterfuge or indirection about who is actually receiving that prescription. Through you.
Representative Srinivasan.
Through you, Mr. Speaker, focusing on the transmission of this prescription. That's where you see an extensive part of this legislation deals with that. And if the good chair can explain to us very briefly as to what is required when a prescription has to be sent electronically. Through you, Mr. Speaker.
Representative Steinberg.
Thank you, Mr. Speaker. The good representative is correct. This is a very important aspect of the bill, and that's why so much language is dedicated to it. Obviously, this is important because we want to assure that the security of such prescribing is maintained, that it cannot be abused by the person receiving the prescription. Therefore, there are very strict protocols that have been mandated in any number of states which dictate the process by which a written order is translated into electronic prescription and exactly what the pharmacist must do with regard to recording that electronic transmission. So there's really, to summarize, there are records being kept. There are opportunities as close as we can to achieve real-time recording of any such prescription such that there can't be any abuse. Through you.
Representative Srinivasan.
Through you, Mr. Speaker, in this transmission of electronic prescriptions, does one have to start with a written prescription that is then sent electronically, or could the healthcare provider start off with an electronic prescription to the appropriate pharmacy? Through you, Mr. Speaker.
Representative Steinberg.
Through you, Mr. Speaker, that is correct. Through you.
Representative Srinivasan.
Through you, Mr. Speaker, would this electronic mechanical transmission from a healthcare's office, will it have to be done by the healthcare provider, or can the healthcare provider designate somebody, a nursing staff, who he or she would be able to send the transmission? Through you, Mr. Speaker.
Representative Steinberg.
Through you, Mr. Speaker, this is such an important area that we require the practitioner to be directly involved. Through you.
Representative Srinivasan.
Through you, Mr. Speaker, I was not clear on the answer. If the good chair could repeat that answer for me one more time. Through you, Mr. Speaker.
Could you clarify that answer, Representative Steinberg?
Thank you, Mr. Speaker. I will try. Because of the risks involved in prescribing these kind of drugs, it is essential that the practitioner be directly involved in transmitting that prescription. Through you.
Representative Srinivasan.
So through you, Mr. Speaker, what I understand that, and I want to be clear because this is extremely important for the healthcare provider in a day-to-day practice. Yes, it is extremely important. We all understand opioid abuse, but also we have to take it in the context of the healthcare provider's practice. So what I'm hearing from the good chair is that in this transmission, other than like an antibiotic or maybe some other medications for hypertension, diabetes, where the physician could authorize his nurse or her nurse to send that transmission over. But in the case of opioids, it would have to be the provider himself or herself. Through you, Mr. Speaker.
Representative Steinberg.
Thank you, Mr. Speaker. Through you. That's my understanding. Through you.
Representative Srinivasan.
Through you, Mr. Speaker, in situations, and I know it's described in detail, where electronic transmission is not feasible. A, because there's some electronic glitch and we are not able to transmit. A. B, it happens to be a weekend or it happens to be after hours when the electronic transmission cannot happen till the next day. And in the third situation, where a healthcare provider does not have an electronic system at all, and I know quite a few providers do not have that, in all of those situations, what is the fallback? Through you, Mr. Speaker.
Representative Steinberg.
Thank you, Mr. Speaker. Through you, I'm very glad the good representative brought that up. You will see in the bill there are several specific subsections that relate to just those circumstances that the good representative brought up. We spent a lot of time talking about the specific aspect. Even those practitioners who are still not fully online in terms of using the electronic prescribing capability. There are still physicians out there who prefer the old method of prescribing. I think you will see in the statute each of those circumstances is specifically addressed as exceptions, and there's a clear protocol for how they would proceed in the event that they cannot comply for reasonable reasons. Through you.
Representative Srinivasan.
Through you, Mr. Speaker, is there a sunset date by which every provider will have to be transmitting this electronically? Through you, Mr. Speaker.
Representative Steinberg.
Thank you, Mr. Speaker. Through you. Another excellent question. We talked about that, but we decided that not to put a sunset clause in, not knowing how long the physicians in this group might choose to continue practicing. So we did not put a sunset clause in. Through you.
Representative Srinivasan.
So through you, Mr. Speaker, 2019, which is not too far away, is not the date by which every prescription will have to be sent electronically. Through you, Mr. Speaker.
Representative Steinberg.
Through you, Mr. Speaker, no, there is not that 2019 date involved with this legislation. We expect that that generation will eventually move on, and we may want to revisit this at some point. Through you.
Representative Srinivasan.
So through you, Mr. Speaker, come a long weekend, come a regular weekend, when medications are prescribed. Through you, Mr. Speaker, just for clarification purposes, how does one then send it electronically? Can we wait for the Monday morning, or like in this case, in Memorial Day, come in on a Tuesday morning to be able to send it electronically? Through you, Mr. Speaker.
Representative Steinberg.
Thank you, Mr. Speaker. Through you. Obviously, again, we discussed this. We wanted to be reasonable in terms of their ability to turn it around. The expectation is that at first opportunity, after the conclusion of the weekend or holiday, that they follow through, and their allowances are made in the statute for that consideration. Through you.
Representative Srinivasan.
Through you, Mr. Speaker, there are certain situations in which it may not be, it is suggested that this information not be transmitted electronically. Through you, Mr. Speaker, we are not talking about an electronic glitch. We're not talking about weekends. We're talking about certain situations, through you, Mr. Speaker, that it is suggested that this information not be sent electronically. If the good chair could elaborate on those conditions where we do not have to send it electronically, so we are all clear on that. Through you, Mr. Speaker.
Representative Steinberg.
Might I ask for a minute, Mr. Speaker?
Chamber, stand at ease. Chamber will come back to order. Representative Steinberg.
Thank you, Mr. Speaker, and thank the good representative for the moment to refer to my notes. There are circumstances, exceptions, as I mentioned, under which electronic prescribing may not be necessary. Beyond the glitches that the good representative referred to, might be an emergency circumstance in which going through the electronic prescribing network may not be sufficiently timely to meet the need of a patient, so that might be an exception. Whether the use of electronic might negatively impact patient care, such as long or complicated directions, might be such a reason, or a direction administration for infusion as opposed to other methods of medicating, or a demonstration that the practitioner does not have the technological capacity to electronically transmit. It also may be a circumstance in which the pharmacy is in a different state, which may not be compatible with existing systems. So there are a number of enumerated circumstances. It was a good faith effort to anticipate exceptions such that we would not basically restrain the ability for the prescription to be filled. Through you.
Representative Srinivasan.
So through you, Mr. Speaker, as I understand it then, in these situations which the good chairman outlined for us elaborately, for which I'm very thankful for, in those situations, the information is sent over to the pharmacist, either verbally or in a written order, but not electronically. Through you, Mr. Speaker.
Representative Steinberg.
Through you, Mr. Speaker, yes, that would be the case. Obviously, there are very clear protocols to assure security in that instance as well. Through you.
Representative Srinivasan.
Through you, Mr. Speaker, moving on to the non-opioid forms. So when a non-opioid form is filled, but how does one even be aware of the fact that such a form exists? Through you, Mr. Speaker.
Representative Steinberg.
Thank you, Mr. Speaker. Through you, that's another excellent question. Part of our objective in educating and communicating is to create awareness that such a form exists. We are obviously also heavily dependent on the practitioner who might do the prescribing to make the patient aware of this option. We have not worked out all the details and all the different ways we want to get that information out there, but it is a keystone of this legislation that people become aware of it and that they have choices. Through you.
Representative Srinivasan.
Through you, Mr. Speaker, is it the responsibility of the healthcare provider to inform and provide these forms, or do we leave it to the Department of Public Health to disseminate this information to the public at large so the public are aware when they go to the healthcare provider, they have option A and option B? Through you, Mr. Speaker.
Representative Steinberg.
Thank you, Mr. Speaker. Through you, another good question. Rather than leaving it up to the practitioner or the potential patient to write their own form, we've asked EPH to create a form such that all the key issues are addressed. Through you.
Representative Srinivasan.
Through you, Mr. Speaker, and my final questions, and I'm sure there'll be other members who would want to discuss this at length also. Through you, Mr. Speaker, I see that the number of days of prescription have changed from 7 to 5. Through you, Mr. Speaker, is that applicable to adults as well as children, or to minors only? Through you, Mr. Speaker.
Representative Steinberg.
Thank you, Mr. Speaker. Through you. This is one of the most challenging questions many of us have discussed. The focus in reducing the number of days that can be prescribed from 7 to 5 is focused on minors in this instance, not adults. Through you.
Representative Srinivasan.
Through you, Mr. Speaker, if this legislation moves forward, will the healthcare provider be only allowed 5 days, or will it be at the discretion of the healthcare provider if the need is there? Obviously, we all know not to overprescribe, but will the healthcare provider have the capacity to override the 5 days? Through you, Mr. Speaker.
Representative Steinberg.
Thank you, Mr. Speaker. Through you. I thank the representative for such important distinction. It remains within the discretion of the practitioner to extend it beyond the limited 5 days if there is a sound medical reason, and that reason has to be recorded in the medical record. Through you.
Representative Srinivasan.
Through you, Mr. Speaker, when the decision is made to prescribe an opioid, you can just imagine there's going to be a discussion, there will be a conversation, pros and cons, of the drug that is being prescribed, interactions, so on and so forth. All of that goes on before a prescription A is either physically written or transmitted by the healthcare provider. Through you, Mr. Speaker, will this legislation impose any other requirements on behalf of the healthcare provider?
Representative Steinberg.
Thank you, Mr. Speaker. Through you, yes. There's a section of this bill that requires the Alcohol and Drug Policy Council to investigate the creation of a one-page fact sheet, if you will, which gets into the risks and signs of opioid addiction, which will facilitate a conversation between the practitioner and the patient receiving the prescription, so they can be self-aware, they can perhaps make their own choices, but that they're fully sensitized to the risks inherent in taking an opioid or a similar narcotic. Through you, Mr. Speaker.
Representative Srinivasan.
And through you, Mr. Speaker, my final question to the good chair is, we already have, and as Representative D'Agostino referred to that as well, the drug monitoring program. Through you, Mr. Speaker, will this legislation have any impact as far as the drug monitoring PMP program? Through you, Mr. Speaker.
Representative Steinberg.
Through you, Mr. Speaker, my understanding is that this legislation does not change or expand the current requirements. Through you.
Representative Srinivasan.
Mr. Speaker, I want to thank the good chair and Representative D'Agostino, because this is a very important issue, as you heard both from me as well as from Representative Steinberg, on the importance of addressing this issue and at the same time addressing it carefully, logically, in a systematic form. And that is what this chamber has been doing, of which all of us should be extremely proud of the product that we have come in a bipartisan way. And in this, I want to thank the good chair, Representative Steinberg, for always being available to us to discuss these issues. They have not been easy, there has not been smooth sailing, but there's a lot of discussions, and he's always been available to discuss that. And along with that, Mr. Speaker, I want to thank my good representative, Representative Tweedy, who has worked diligently to make sure that his passion and his reasoning of changing the 7 days to 5 days, he has been a big champion of that, and he has made sure that this has become a part of our legislation, because it is the right thing for us to do, A, as a chamber, B, as a state, for our constituents. So this curse, this crisis, we are able to get a better control of. Thank you, Mr. Speaker.